The cancer incidence is on the increase in Uganda, cervix cancer being the commonest, which is claiming so many lives of women. According to the director, Uganda Cancer Institute, Jackson Orem, of about 22,000 cancer patients who are screened at the Uganda Cancer Institute, 20,000 die each year.
For every 22,000 patients with cancer in a year, 20,000 die. That is an indicator, a crude one, of the mortality related with cancer.
Women are the most affected, and cervix cancer being the major killer among women, at least more than 3,000 women die of cervix cancer alone each year. According to Dr. Mugisha, the challenge is that many cancer patients seek medical attention when it's beyond control, adding that if detected early, cancer is curable. He adds that there is a lack of specialized cancer doctors within the country having less than 10 doctors, 5 of which are at the Cancer Institute. These are overwhelmed by the numbers of patients in addition to lack of facilities like an operational theatre.
Many cancers, the mainstay of treatment is surgery. And the surgery can be done by any surgeon anywhere in Uganda. But in developed countries, cancer surgery is done by oncology surgeons.
The situation is, however, worsened by the increasing cancer in communities, with Busoga registering the highest numbers at the Uganda Cancer Institute, mainly suffering from Burritt's lymphoma that is most manifested in eastern Uganda.
The commonest cancer in the area of Busoga is Burkitt's lymphoma, which is a cancer that affects lymphatic tissues.
Margaret Okele is a 52-year-old breast cancer survivor. All her breasts were cut off after they were detected with cancer. She says before it was detected, she had put on a lot of weight before she discovered that there was something unusual that was slowly manifesting in the left side of her breast.
There's what we call breast self-examination, whereby you feel the lump, okay, if possible, or if you feel there is discomfort in your breast, please go and have a checkup. You may not feel the lump yourself, but the health workers may help you to detect that lump.
Okelo took several tests at the Uganda Cancer Institute, and all results confirmed the cancer of the breasts, which was already affecting both breasts. At this point, she became vulnerable to all advice, but above all, she surrendered to God. The medicine administered to her was so tough that she lost all her hair and the entire body reacted to it.
When I started the chemo, I was told briefly how it's going to affect me, the side effects of that drug. That is loss of hair, discoloring of nails, I became dark and I couldn't had wounds in my mouth, the tongue. I was like I've never brushed my teeth since I was born. It was all clogged. And then I started that treatment.
Her appeal today is that people should learn to self-examine, especially women, to ensure they keep examining their breasts, but more so, avoiding self-medication and the use of herbal medicine.
Don't listen to these issues of herbal medicine. I'm not saying herbal medicine is bad, but there's no evidence that herbal medicine heals cancer.
Now, as the Cancer Institute marks 46 years of existence, they are trying to open screening centers at the referral hospitals of Marara and Arua, with a community screening center in Busoga sub-region, in an effort to step up early treatment for those who will be found with cancer. However, cancer can be prevented through avoiding exposure to too much sunshine, control of sex behavior, change in food diet, especially reduction in eating fats and pork, avoiding alcohol, smoking, and taking too much sugar that puts one at the risk of contracting cancer.